My name is Yue Hua, and I'm a research fellow at the RISE program, which stands for Research on Improving Systems of Education. I'm here to tell you about research conducted by some of my RISE colleagues in a presentation titled Teach a Girl to Read and Improve Her Well-Being for a Lifetime. Evidence from 54 countries. The motivation for this piece of research, and for the RISE program as a whole, is that the overwhelming majority of countries around the world have been wildly successful in increasing school enrollment. But these increases in enrollment have not translated into increases in learning. For example, this graph shows a RISE analysis of financial inclusion insights data, and if we focus on the dotted grey line, we can see that literacy rates among primary school completers vary hugely from 20% in Nigeria to over 80% in Indonesia, Rwanda, and Tanzania. And in 6 out of 10 of these countries, fewer than half of all adults who completed primary school are literate. These low learning levels are despite countless educational interventions and policy reforms, and countless pieces of research studying these interventions and reforms. At the RISE program, we seek to address the learning crisis in low-income countries by looking at education systems holistically and focusing on relationships of accountability within these systems. We're trying to build a cross-country systems-level evidence base on what exactly the learning crisis looks like, why learning levels are so low in some countries, and how these systemic issues can be remedied. Over 100 people work in RISE across a range of research teams and institutions, and focused in 7 countries. We use a range of methods from ethnographies to econometric analyses, and besides building an evidence base, we aim to distill research into usable forms for policymakers and practitioners. Today I'm going to focus on a line of work by RISE colleagues Michelle Kaffenberger and Lat Pritchett, as well as Justin Sandifer from the Center for Global Development. In this analysis, they disentangle the benefits of schooling attained from the benefits of literacy gained. If you're interested in reading the full paper, there will be a link on the last slide. And the starting point here is that if schooling doesn't necessarily translate to learning, how can we understand the benefits of schooling, learning, and education for children? They explore this by using data from the Demographic and Health Survey, or the DHS, which is funded by USAID. Since 1984, there have been over 300 DHS rounds in 90 developing countries. And this study focuses on women who took the DHS literacy test, which was introduced in the year 2000. This literacy test was only administered to women whose educational attainment was primary school completion or less than that. So my colleagues analyzed 129 survey rounds in 54 countries involving nationally representative samples of more than 800,000 women. The outcomes of interest here related to the well-being of adult women were firstly women's total fertility, secondly child survival, which is calculated as the number of live children a woman has divided by the total number of births she's had, and finally a scale constructed from 3 questions related to women's empowerment. And these questions were whether the woman has a say in decisions, for example, about healthcare, visiting relatives, or what to do with money the husband earns. Secondly, whether it's justifiable for the husband to beat his wife in a range of circumstances, such as if she goes out without telling him, or if she neglects the children or burns food. And finally, whether the woman has the right to refuse sex to her husband on the grounds of his infidelity. To measure literacy, DHS enumerators each have cards with simple short sentences in a variety of languages. If a woman says she completed primary school or less than that, the enumerator will then ask her to choose the language of her preference and give her a card to read, and will use the codes as shown to classify her level of literacy. And in this study, if she could read the full sentence, then she's regarded as literate. Note that this is a low bar. These are simple, short sentences like parents love their children, and there's no comprehension element whatsoever. So on balance, it's a very crude proxy for literacy. Besides being a low bar, also note that there's a significant risk of measurement error, as in any household survey. For example, even if the respondent can read, she just might not feel like reading at that point, or the enumerator might be in a hurry and they might fill in an inaccurate answer. Or the person who's keying in the data into the main data set might make an error in coding. In the DHS data, there's a variable and often shallow relationship between schooling attainment and literacy. Among women who completed grade 6, literacy rates range from over 97% in Rwanda to less than 10% among several countries at the bottom of that chart. In half of the countries surveyed, half or more of women with 6 years of schooling remain illiterate. That means that schooling doesn't necessarily equal learning, and conflating schooling and learning is problematic, especially if used to inform policy. Even with a simple cross-tabulation by level of schooling and level of literacy, there's a clear difference between the impact of schooling alone and the combination of schooling and literacy gained. Among women who completed 6 years of schooling, on average 23.7% have experienced the death of a child, which is the second bar from the left. But if we separate this group of primary school completers into those who are illiterate, which is the bar in the middle, and compare it to those who can read a full sentence, which is the bar on the right, there's a substantial difference. So if the analysis only looked at schooling, then that would obscure the large range of variations shown in the 3 bars on the right. Beyond cross-tabulations, a typical regression analysis will look just at school completion or educational attainment, which would lump together both the effects of schooling and the effects of learning. But if you have data on learning, such as literacy rates, it's possible to break this down into the impact of learning and the impact of schooling. Also, given that in many low-income settings, completing 6 years of primary school doesn't actually lead to literacy, these estimates don't represent what many people have in their heads when they want to know how much basic education can improve adult well-being. So it's possible to take these estimates and then scale the impact of learning to match a baseline of the learning that we would want and expect children to get out of primary school, such as achieving literacy. Bearing in mind that, for the DHS data, this is the low bar of literacy discussed earlier. And we call this the impact of basic education, that is, completing 6 years of schooling and achieving basic literacy during those years. So when you run through these estimates with the 129 rounds of DHS data in 54 countries, this is what you get for the typical estimate of completing 6 years of schooling, using the measure that lumps together the impact of schooling and the impact of learning. So 6 years of schooling results in notable improvements in adult women's well-being, a 10% reduction in fertility, which equates to having 0.33 children fewer on average, a 21% reduction in child mortality compared to the baseline of 1 in 10 children dying, and a 0.14 standard deviation improvement in the Women's Empowerment Index. But when you estimate the impact of education, that is, completing 6 years of schooling and achieving basic literacy, the picture looks even better. There are improvements in fertility reduction from 10% to 11%, in child mortality reduction from 21% to 24%, and the Women's Empowerment Index improvement goes up from 0.14 to 0.18 standard deviations. And it's important to note that for each of these outcomes, a non-trivial part of the well-being improvement comes from acquiring some amount of literacy, and not just from merely attending schools. Another key point to note is that the measurement error in household surveys, as mentioned earlier, also plays into this. For example, there are any number of reasons why a survey enumerator could have made a mistake, or why a survey respondent might not have read the sentence at a particular time. And this is especially tricky when you're trying to break effects down into different categories, like schooling attainment and literacy, because a mistake in one measurement will have effects on both categories. For example, if 10 people were voting for or against a particular politician, and one person switches their vote, it changes the vote margin not by 10%, but by 20%. So, because of this measurement error issue, my colleagues use the best available techniques to control for measurement error. That is, by using instrumental variables to correct for possible errors in both schooling and literacy. The instrument they use is an enumeration area leave-out mean, which you can read more about in the working paper. And when you control for measurement error, the results are striking. Firstly, education has a much bigger impact on women's well-being than the typical estimates on the left. Specifically, the impact of education on a woman's well-being as an adult is 2.5 to 4 times bigger than the standard methods suggest. Secondly, for all 3 outcomes, at least a third of the impact comes from learning to be literate, rather than just spending time in school. It's especially noticeable for women's empowerment, which makes sense given that gaining knowledge and skills is a fundamentally empowering and confidence-building achievement. Now, these may look like oddly large improvements in the measurement, but two things to note here. Firstly, it's not uncommon for regression results to change this much when you use instrumental variables to control for measurement error in household surveys. And secondly, my RISE colleagues found results of a similar magnitude when using a different data set, specifically the Financial Inclusion Insights dataset for 10 low and middle income countries, to look at how schooling and literacy improve respondents' money management behavior. And in case you're wondering, that was the dataset that I showed you on the very first graph at the beginning of this presentation. Here's the bottom line. Typical estimates of the impact of schooling are just measuring the impact of schooling at current learning levels. And if learning were consistently high, this would be an okay proxy for real education. But because learning levels are so low, this radically underestimates the potential impact of schooling if schooling consistently produced learning. One clear implication from this is that it's important for education systems to invest and plan for learning, not just to improve access to schooling. Access and enrollment are easier to achieve and can be done using logistical, input-based approaches. But such approaches lose out on so many potential gains in public well-being. It's simply not okay that, on average among many low-income countries, half of young women spend 6 years of their lives in primary school but don't learn to read during that time. If you'd like to learn more, you can use that short link to download the paper, or feel free to send me an email. Thank you very much for listening, and here's hoping that all children get the learning opportunities that they deserve.